Welcome back. It's Frankie Boyer. And so, we have been hearing a lot about some new technology in the world of in the field of orthopedic surgery, and one of those procedures is to get people that have been maimed, that have had terrible accidents, birth defects. Wouldn't it be wonderful if we could lengthen one of their legs? Wouldn't it be wonderful if we could give them that ability? Well, years ago, that was science fiction, but not today. And we have with us today one of the leading surgeons in this field, and he is one of the few doctors that has a real deep understanding of the practice of limb lengthening. And it's a surgery that gives thousands of people that have been born or accidents, it gives them hope. And Dr. Khosroabadi is with us today. And welcome, Dr. K.
Thank you very much. You finally got to say my last name.
So tell us about, you're one of the handful, just a few of these brilliant doctors. You're just one of these brilliant doctors. So you have techniques from where, Russia?
Well, this technique was actually created back in Russia in the 1950s.
Yeah.
And it was created by a doctor called Dr. Elizarov. And they've been doing this for over 50, 60 years. And for the past 20 years, we've been doing them in the U.S. A couple of our, orthopedic surgeons went to Russia and learned this technique, came back. I've been doing this for the past 5, 6 years. I'm a foot and ankle specialist. So this is something new that's getting out, and more people are learning about it, but it's really not such a new phenomenon. This has been done for 50 years. It's just never been advertised or popularized.
Well, there was a segment on television a few months ago that was strictly for men that wanted to be taller. And we're not talking about that. We're talking about some very specific issues with regards to accidents, birth defects, and those kinds of things. So what you're really trying to do is give somebody an opportunity to have a normal life by both legs being the same height.
That's correct. Basically, what my passion has been, get people back on track, get them walking again. There are patients who've had terrible car accidents or motorcycle accidents, or, as you mentioned, birth defects like clubfoot or congenital deformities, and they've never really been able to walk correctly. So what we do is we actually go in and break the bone, put this device on, and the patients actually go home and turn these struts. And
it looks painful, is it?
Believe it or not, the first 2 weeks is the most painful part, which is still very manageable. And after that, patients don't feel it because we actually move the bone 1 millimeter a day. And that's actually moving it half a millimeter twice a day. So it's not really felt throughout the bone, because our bones actually don't have any nerve endings inside of them. It's only on the outside that there's nerve endings. So it's not a very painful process, but usually physical therapy is the painful process part of it.
Yes, I'm sure it is. And so how long would it take for someone that came to you with a club foot, let's say, or someone who has had a terrible accident? How long would it take for the foot to reach the desired length? Is it months down the road?
Yeah. I mean, it depends on the deformity. If it's a really bad deformity that we have to move the bone few centimeters, so if you calculate it 1 millimeter a day, if we're talking about 2 or 3 centimeters of movement of the bone, so we're talking about at least 30 days of moving, and then you need another 6 to 8 weeks so for the bone to heal. So we're talking about at least a good 4 to 5 months, and then that's when the device comes off, and then they go into a cast, and then to a boot, and then slowly to a normal shoe. So we're talking about 6 months, 7 months.
But at the end of the 6 months, for someone who has been, incapacitated and handicapped for all these years, wow, what a miracle you're giving them. What a
Well,
gift.
yeah, it's been quite satisfying, at least for me. I mean, these surgeries are not walk in the park. I mean, I spend usually anywhere between 6 to 8 hours in an operating room for one of these cases. So, some of my friends always ask me, wow, you spend so much time in the operating room, and and you pretty much, see these patients on a weekly basis. But like you said, the gratitude of the patient and just you see your final result is just quite satisfying.
I guess the question is, Doctor, when you first got into this field, how big a problem is this? And give us some tips, by the way, on what we can do to keep our feet and our ankles healthy.
Well, I mean, how big of a problem it is if you don't know that there is help, then you really can't get help. What I mean by that is there are patients now, as we speak, that are walking and they're deformed. They have a malformation in the bone, or they had a terrible accident, the leg is crooked, but they've been told that there's nothing else they can have done so they can be better. So we don't know how common these things are because these patients don't even know that there is help. But as things like this, like today's show, that I'm on your show, that people are more and more aware of it, and they tell their
That's
friends.
why by the way, we need to give the website and more information. It's footandanklealliance.com.
Correct.
Okay, footandanklealliance.com, 626-447-2184. That's 626-447-2184. If you know of someone or you are struggling yourself, you need to know about the procedures that Dr. K offers. So go ahead, Doctor. And you're located in L.A.?
Yeah, I mean, actually in Los Angeles, California. So,
okay.
We've been trying to have a good web presence because most of these patients, when they go to their doctors, they don't get much help, and they have been, being turned down for the past 10, 15 years, so they're kind of used to it. So, and then one day they just go and say, oh, let me see if I can find anything about my condition, and they start doing a search, and then they finally find someone like me, and they come and they find out, wow, I could have been helped 10 years ago.
Yeah. Oh, it's a wonderful opportunity for anyone out there that if you know of someone, the Foot and Ankle Alliance, footandanklealliance.com, 1-877-FOOT 911, 877-FOOT 911. I love that. Thank you, Dr. K.
Okay, thank you, Frankie.
And we will be back in just a moment. Stay tuned. This is Frankie Boyer.